Hi everyone, good morning. It is Sunan from Center of Balance, the Acupuncturist and Chinese medicine herbalist. Today is Thursday and it's 10 o'clock New Zealand time. And welcome everyone. And the topic we're going to talk about today is the definition of infertility. Right? Okay. Now, if you been to us and you can see in our office, you see that we in our clinic, in our office, and on the wall, we have a lot of babies photo. I'm currently at home. I'm not in the clinic, so you can't see that in here. Oh, someone called me So what we're going to talk about is the definition of infertility, and you're watching me on Facebook page or YouTube. Right now, if you have any question later on, please leave it down there. Right, just leave your question down there, and I'll come back and answer your question. If I can't see your question, I can't answer you right now, but I'll come back later on. Okay, but if you have while I'm live, you can just type in and put your question down there, and if I can see it, and I'll be able to answer you. Let's start. Let's talk about the definition of infertility. Right. So a diagnosis of infertility means you haven't been able to get pregnant after a year of trying. If you are a woman over 35, it means you haven't been able to get pregnant after 6 months of trying. Right. So there's a bit different in here. So if you are younger, I mean, before 35 years old, and you've been trying for a year without any results, without pregnancy, getting pregnant. So that is about a year that you've been trying without any results. Then we put a head on infertility, and that means you should go to your doctor to get more tests. We'll be able to talk about tests in other live video. And if you are over 35 years old, and that come to 6 months of trying rather than 12 months. Okay, so that is about the difference in here. Okay, this thing changed the definition. You can go to a different website and different doctor, and they have a different idea. Okay, but this is more common in here. I remember when I was in medical school. It was more 15 years ago, and when I studied about the infertility case in the textbook, and I remember that we say that it's about 2 years of trying. 2 years of trying, right? So a couple, doesn't matter what age, 2 years of trying without any results, then they put a head on you, infertility. And now you can see that in here, we're talking about a year. If you're younger than 35 years old, it's a year. If you're over 35 years old, and that is just 6 months. So at the definition cut down, the time frame is actually shorter, okay? So women who are able to conceive but not carry a pregnancy to term may also be diagnosed with infertility. But this type of infertility, you get pregnant, you can't hold the baby, you can't, you have the baby probably die in the tummy, or you lose it. And we give it another name we call miscarriage. and rather than infertility. But it's still counted infertility, a type of infertility, but maybe we more talk about as miscarriage rather than say infertility. When we say infertility, normally we say you can't get pregnant. Okay, so that definition is a bit changed. People sometimes mix up fertility with miscarriage, but in our term, we're more likely to say, well, this is miscarriage. Infertility is a bit different. Okay. Yep, I hope that makes sense. So a woman who's never been able to get pregnant will be diagnosed with primary infertility. So a woman who's had at least one successful pregnancy in the past will be diagnosed with secondary infertility. So that's a bit different, the definition, right? If you never had a baby before and you never been pregnant before and you can't get pregnant, and that means there's a primary infertility. If you have one or two or more babies, pregnancy in the past, then you want to have your third or fourth or fifth baby, but you can't seem to be able to get pregnant again, then we call it secondary infertility. Okay, so infertility isn't just a woman's problem. So men can be infertile too, right? In fact, men and women are equally likely to have fertility problems. So it's very a big wrong idea, you know. All men think about when it comes to infertility, all about women. That's not true. And especially in Chinese culture, you know, it's very bad in here. They have an idea, and you know, in the old time. I'm talking about in the old time. If so, that's in the old time, they have a man can have few women, a few wives. Yeah, so it can up to like generally get 2, 3, 4, 5. They can come to 5 to 6 just because they want to have a baby, and they didn't realize that it's not the woman's problem; it's the man problem. It's the main problem, right? So that is so in Chinese culture in the past. I'm not quite sure about the European culture, in the West culture. In the Chinese culture in the past, there's a lot of movie now. You can see that they keep getting more and more wives, but no result of pregnancy. Yeah, it's all about woman problem. That's not true. So I need to tell you that that's not true, especially now if you're men and you have the idea of, oh, it's all about women. That is not right. Okay, so I suggest if you can't get pregnant over about a year or 6 months, if you're over 35, and you both of you need to get some tests done. So go to a GP and refer your fertility associate, then or you can come to us and we will show you what sort of test that you need to do. Okay. Okay. Now, according to the Office on Women's Health, about 1/3 of infertility cases can be attributed to female infertility, while men's problem account for another third of infertility cases. So the remaining third of cases may be caused by a combination of male and female infertility. So, or they may have no known causes. That means that so 1/3 of the causes from female, 1/3 of the causes from male, and there's another 1/3 of the infertility causes are from both female and male, right? And it could be no known causes, like you run all the tests and for the female and all the tests for the male, and both of them are healthy. Everything's normal. Okay, so they counted as no known causes. But that is, I just want to let you know that is just according to Western medicine. Okay, but in Chinese medicine, it's very different. The reason I said that is because we have a different system to diagnose what's going on in your reproductive system, in your health system, right? So I hope you can see it over here. Just checking. Now you see kidney and bladder, right? They're controlling reproductive system. So they're very important. We need to check whether your kidney are healthy or not, right? And not just that, because in the heart, the small intestine, both controlling the blood circulation. So a lot of them is because blood circulation, you not have enough blood, and it could be from heart problem. So heart problem will cause infertility too, right? This is according to Chinese medicine. So even though you have all the tests done, like most of the time, the female come and male come to a clinic, and then the female done the test on all the sperm are normal, but I say, well, the sperm are normal, but it doesn't mean that you're healthy, right? Okay, the reason we talk about here is all the tests have a limitation. There's a limitation. Let's say, well, you feel tired all the time, and you get cold hands, cold feet. And as a female, you get clots. You know, when you have a period, you're bleeding, you get clots. And you have PMS, which means when you lead to your period, you get frustrated, you cry a lot, emotional, what we call mood swings. And also you get tummy pain, you get diarrhea or constipation when you have your period. And you know you're abnormal, but all the tests came out normal. And let's see, and all the skin came out normal. You don't have a PCOS, you don't get endometriosis, and no infection, everything is good. Then what happened now then? You can't get pregnant, and they tell you there is no cause. There is no known cause. Everything's normal. We don't know what's going on. But you know it. Your period is abnormal. You don't get your period on time, and you get cramp, sore back, right? Emotional, a lot of clots, and your period it should be 4 to 5 days, and you only get 2 days. But all the tests came out normal, and that means that's still abnormal. In our case, in our system, in TCM system, we have another way to look at you. So when we see an infertility patient, we're not just relying on all the tests. Those tests are important. It does tell what's going on with you, but it's not we know it's not the whole picture. Okay, so I hope that helped you in today's live video. I hope you learned something, and this is what we talk about, the definition of infertility. And next time we're going to talk about other thing about infertility. And I hope you stay in tune and come back and to learn more. If you have any question, please leave it down there, and again I'll come back and answer when I see you your question. And you are welcome to come to us and to get an initial examination, and we'll be able to sort out to find out what's the diagnosis according to Chinese medicines. And if we can find out the diagnosis, what's going on with the organs, and we'll be able to give you a treatment plan and suggest what you need to do about it. Okay, if you have tried IVF and failed IVF for a lot of time, and yeah, do come to us, because we have a different system to look at your body to help your body get balanced again and to prepare for your pregnancy. Right. Stay awesome, and I hope you guys are doing well, and I'll see you next time. And we have Kevin going to talk about what he talk about pain conditions, lower back pain today. Okay, so I'll see you next time. Bye bye.